Okay, so here is some HCPCS Level 2 modifiers that would be appended to the anesthesia code. And we'll see how those, we're going to do some examples towards the end of, at the end of the screencast, and we can see what that looks like. And then also there's some CPT modifiers, and this is just to name a few that can be appended as well, and they do go in greater detail in your textbook. And then also qualifying circumstances. Though technically these are not modifiers, these codes serve to describe anesthesia services under unusual or difficult circumstances. And actually these codes are found in the medicine section of your CPT book. This last one, the 99140, this anesthesia complicated by emergency conditions, and where it says specify, emergency is defined as existing when that delay in treatment would lead to a significant increase in the life or life of a body part. And then here's just a few Medicare policies that anesthesiologists and or CRNAs are required to follow regarding the QK modifier, what needs to be documented within that medical record for anesthesia. And we're not going to dive totally into this, but anesthesia services are reported based on time, and it begins when the anesthesiologist or the CRNA starts prepping the patient to receive anesthesia, and it ends when the anesthesiologist or that CRNA is no longer in personal attendance. And reimbursement for anesthesia will vary according to increments of time. Some carriers follow Medicare policy and guidelines and others do not. So the billing, if you're working for an anesthesiologist, the billing department and or the coders would need to make sure to check with their local payer contracts for specific guidance. And then 1 unit of time is equal to 15 minutes of anesthesia time. And this is recommended by the AMA, the American Medical Association, and the ASA, the American Society of Anesthesiologists. And then just here is what that formula looks like, and I believe that's in your textbook as well. So I just wanted to throw it out there, but again, we're not going to go into great detail of this because it's not something that we're going to dive into in this course. So let's do it just a couple examples real quick, finding your CPT code for anesthesia. When looking up in the index, you always start with the word anesthesia, and it's very important to know the anatomical location to that type of surgery being performed and that surgical approach. So in this example, corneal implant in a healthy patient by our CRNA without medical direction. So you're going to go, and you can pause this at any time to look it up to see that flow of looking it up in the index and then going to the tabular and seeing what that code looks like. So if you go to anesthesia in the index and then find corneal transplant, you'll come to code 00144. And of course you want to go look it up in the tabular section, and you'll see that it fits, and then P1 for a healthy patient. And remember our physical status modifiers, P1 normal healthy. And then our example also said QZ, and that was by a CRNA without medical direction. So if we went to our HCPCS Level 2 modifiers, QZ right here, CRNA without medical direction. So our code would look like 00144 P1QZ. So let's look at one more real quick. A 63-year-old male presents for a revision of a total hip arthroplasty in a patient with severe systemic disease performed by the anesthesiologist. We're going to go to our index, to anesthesia. We're going to look at hip. In the index, we have a code range. So now we're going to need to go to the tabular and see what code in that code range fits. If you look in your tabular, you will see 01215 states revision of total hip arthroplasty. And then again, our status modifier for the patient would be P3, the anesthesiologist would be AA.